Hi, welcome back to the channel. I'm so sorry that we're starting a bit later than planned today. My schedule jumped ahead of me and I've just not been able to catch up, but I'm glad that we can still make this meeting. So thank you for joining. I'm Dr. Sylvia. I'm a general practitioner, a GP, and a health educator with Askawayhealth. And today, on the 5th episode of our Friday live class, we're going to be looking at a few things around women's health topics. Specifically going to be talking about fibroids and pregnancy, when we're also going to be talking about the contraceptive implant and one of its side effects, irregular bleeding, and what can be done around that situation. And then looking at another topic that's a little bit technical, I think, but it has to do with the effect of the emergency birth control pill on ovulation and LH surge. Now, these topics are usually based on questions that my viewers have posted. So in response to a video I've published or a comment I've put out and people want to clarify. So I like to use this medium to address these questions, because I think instead of waiting to create another video or trying to answer it in the comments, which technically doesn't really help to provide as much information as you can, I thought this is a good forum to be able to provide that information to people if needed. So if you're joining the live, hi, welcome. I'm just going to jump straight into the first question. So I'm going to put it up on the screen so that you can see, but I'm also going to be switching in between the main screen and going into some pictures that I think would help. So let's get the first question up. But let me just put this as well. Don't forget to like the video and subscribe to the channel. Please subscribe to the channel. It's really important. We hit the 7,000 subscriber mark this week. Yes, this week. And wonderful, really great to know that 7,000 people have subscribed to the channel, find a lot of value from the things that we're sharing. That's really great. And I want to encourage us as much as possible to engage and comment and ask questions. This is Askawayhealth. It's about asking health-related questions, issues that do with your health. We welcome these questions so that we can talk about them, clarify. The goal is to help us live better. So please comment, engage, ask your questions. And yes, we do want more subscribers. So just to put that out there. Okay, so for the first question we're looking at is, how can one get pregnant with 4-centimeter uterus fibroid? So this is a question that one of my viewers has put through. So I'm going to start by sharing my screen, and then we can talk about this. We can talk about this question. And just a second. Make sure I've got the right bits up and make sure you can get all the information that's available. So just bear with me. Here we go. So I think we should have that image up. And I wanted to share this image of a womb. This is obviously an operation going on here, a womb with fibroids and surgeries going on. But I wanted to give us a sense of size. So this question refers to a 4-centimeter uterus fibroid. According to the tape that's been held, I don't know how closely you can see, but this is going beyond 15 or 16 centimeters in terms of the size of the entire organ. So if you think about a fibroid of about 4-centimeter mark, I think is sort of here. This bit, my cursor is not doing what I wanted to do this morning. But yeah, so sort of around that area. Size of a fibroid. So it's not a huge one, but it is significant. And I wanted to give us an idea of the size when we're looking at fibroids, because what is important in terms of the fibroid is not just the fact that it's there, it is where is it, what's the size, and where is it, and what type of fibroid it is. So I'm going to explain that a little bit better. Now, as a reminder, a fibroid is a benign growth within the womb. And please go ahead and check the channel for our fibroids playlist, where we talk about this extensively. We discuss different types of fibroids. We talk about how fibroids happen. We look at risk factors for developing fibroids, and as much as we know anyway, because medical science doesn't altogether know exactly why fibroids happen in some instances. We know some of the issues, things like hormone, estrogen, related to developing fibroids, but we don't know everything about how a fibroid develops. There are lots of research thoughts, research opinions, but not an exact cause. So please go and have a look if you're looking at details. We, of course, talk about treatments. I talk about symptoms of fibroids. So we've got several videos in this channel looking at fibroids. So please go and have a look at them. But today in particular, we're looking at effect on fibroids. The symptoms of fibroids are many. Different women have different fibroid symptoms. We talk about fibroid pain as one of the most common symptoms, of course. Things like the fibroid growing so large, it's putting pressure on other organs and contributing to not just pain, but problems like constipation or problems with passing urine and so on. But when it comes to pregnancy, I think it's really important to state a few facts, which is that it is possible to be pregnant with fibroids. It is possible to have fibroids and to fall pregnant and then to go on to have a natural birth in some cases. So there are possibilities, and that's why it's always good to look at individual circumstances. I think fibroids is one of those conditions where one pill does not suit everyone. So there's a wide variety of different treatments or treatment options because there are a wide variety of different symptoms that don't just happen in one person but can affect women differently. Even in women who have fibroids of similar size may have different symptoms. So it's good to bear that in mind. Okay, I'm going to stop sharing this photo and I'm going to pull up another one that I think is also of interest, and I want to use that to explain about one of the things I've mentioned that's relevant to getting pregnant with fibroid. So what you're looking at now is the image of the womb with a baby, a growing child within the womb. But what I want you to pay attention in particular to is the layers of the womb. I'm not sure how much. Let me just take away this. Let me hide this so you can see this better. Yeah, okay, fine. So you can see the image. And I wanted to look at particularly the layout of the womb. So just looking at the womb in section, broadly, there are 3 layers. Okay, from the top to the bottom, looking at the top of the bottom, baby's head is towards the bottom. You can see the cervix. So this is just to allow us orient ourselves properly around this picture. So this is the womb as it would be in a woman who's standing upright. Baby's head is down, which is, sort of the usual, more common presentation for the baby. And you have the cervix, which is the neck of the womb at the bottom. But what I'm interested in this video are broadly the 3 layers of the womb. There's the outer layer. Okay, there's the outer sheath. So if you think about the outer covering of the womb, and there's the middle layer, which is usually a muscle, which is a muscle layer. And you have the inner layer, which is where the baby in its water sac or amniotic sac sits, where the placenta is fitted to. So those are the 3 main layers of the womb. Now, this is important because we've said about the issues that affect a fibroid and pregnancy. The size, the type, and the location. So I'd like you to just have it at the back of your mind that we're talking about 3 different layers of the womb. Okay, now we've got this. Let's come away from this image and let's get another one up, because I think it's useful to have, to see these things as we're talking about them. It sort of makes it more you can relate better to it, can't you? So let's put this next picture up, and then hopefully makes it clear what I've been referring to. So this picture looks at the types of fibroids, and I'm going to combine this now with the location and types of fibroid. In terms of location, a fibroid can either be located in the first layer, the outer layer, which we talked about in the previous picture, could be located around the middle layer, that's that muscle layer, or in the inner, or come from the inner layer. So fibroids, that's when we talk about the type and location of fibroids, that's what we're referring to. Where are they positioned? Where are they coming from? So if you look at this first structure here, and let me just see if the cursor is doing its own thing today. But the first one up here, the subserosal fibroid. Now that's coming up from the outer layer. You can see it's coming up from the outer layer. It's unlikely to do anything to a baby growing within the womb. This is the womb cavity. This bit in the dark red is the womb cavity. So it's quite unlikely for that fibroid that's growing out here. It's known as a subserosal fibroid. Quite unlikely for it to do anything to the baby now growing within the womb cavity, because, or within the womb space. Don't forget that fibroids do grow in pregnancy. The pregnancy hormones can influence as the baby's growing, fibroid can be growing. So potentially this fibroid here can grow, it can cause pain. Now, commonly women who fall pregnant and with fibroids may have this type of fibroid, a subserosal type of fibroid, which doesn't really do anything to the inner lining of the womb generally. So that's one of the types that a woman can have, and she can go ahead to get pregnant and carry her pregnancy to term, because that fibroid is away from the inner part of the womb. But it might grow bigger, it might cause her to have pain when she's pregnant. So I'm not saying that there may not be issues, but generally this may not affect the ability to get pregnant or ability to carry a pregnancy. Now, other type of fibroid is the one that grows within the muscle of the womb, the one that grows within the muscle of the womb. Now, we generally refer to that as an intramural fibroid. So, you know, we talked about the middle layer. The middle layer now is what I'm referring to of the womb, and that's muscle. And so you have a fibroid that grows within that space known as an intramural fibroid. Now, that can depending on its orientation, how it's positioned, which direction it's growing towards, can have an effect on a baby or if a pregnancy developing. Because what happens, the key thing that happens is it distorting, or is it changing the lining, the inner aspect of the womb? Is it making the space narrower? Is it making the space less smooth? Is it in some way disrupting the normal architecture within the womb that is meant to hold the baby? If the fibroid is able to do that, then it can potentially affect the possibility of getting pregnant, and the possibility of the baby growing normally as it should. So those are the issues around that particular type of fibroid. If it's a small one and it's growing more towards the outside and not really affecting the inner lining or the womb cavity, then it's less likely to cause any problem. But now let's go to the third type. And I'm speaking broadly because I just want us to have an understanding, and we're trying to answer this question. The third type that we'd be concerned about, and this is the type that can have an effect on the a pregnancy happening, is the one that arises from the inner lining of the womb. So we talked about the outer lining, we talked about the middle, and then we talked about the inner. Now this one affects the inner, and is usually known as a submucosal fibroid. And as you can see, it's growing in such a way that it's jutting into the womb cavity, the inner cavity. So again, this can distort the womb lining, the cavity itself. It can affect the size of the cavity, so make it smaller, and so the baby is struggling for where to implant. And when it's trying to grow, there's the fibroid in the way. The fibroid itself can bleed, so it can cause lots of different problems because it's located in a way that it's affecting the cavity, the lining of the inner lining or the inner space of the womb. The other issue that you can have is in terms of location of where exactly the fibroid is placed. Now, look at the womb, just look at the womb's shape. If you look at my video, which I did on the functions of the cervix, I showed you the shape of the womb as an upside down pear, and it's sort of similar to what you're seeing on this picture. So you can have fibroids happening at the top, which is known as the fundus of the womb. You can have fibroids going on along the sides. So if you think of the womb as sort of that upside down triangle. So you can have some happening at the top, and then you can have some fibroids going along the side and then towards the tip. Now, towards the tip is where I'm referring you to now, because that's the cervix, that's the neck of the womb. The channel as you go down is the vagina, but that's the cervix, and you can see this fibroid, which is a type of submucosal fibroid because it's growing from the inner lining, isn't it? So this fibroid is managing to dangle itself into the vaginal canal through the cervix. So that fibroid has nicely blocked, if you like, the birth canal, hasn't it? You can see if this fibroid grows, assuming the woman can get pregnant and the baby can implant, what happens as the baby grows and the fibroid itself grows, you have the possibility that it can close off the cervical canal, assuming it doesn't do other things like cause bleeding as the pregnancy progresses. So these are the reasons why the location and the type of the fibroids matter when you're looking at the possibility of pregnancy. So please, let's get it straight. It is possible to have fibroids and to fall pregnant and go on to deliver. Many women have done this, but it depends on different things, including the size of the fibroid, the type and location of the fibroid. Those are the issues to consider. So I think we've gone into this at length. Now, with regards to size, she talked about the 4 centimeter fibroid. Now, that's not a huge fibroid by any streak of the imagination, but I would also be interested in where is this fibroid located. So again, this is why answering this kind of questions on YouTube comment section doesn't really help, because you need a lot more information from this lady to be able to work out what's going on and the best advice to give. So while I'm saying that, I would like to remind you that Askawayhealth has an email advice service that you can use to send information, to send questions through, and myself or one of our clinicians will respond to your questions. Any question that's health related, you want some guidance, you want some advice, some clarity about a particular health related issue, please send that through to us. I will place the link in the description box below. I'm not very sure if I can share the screen to show that. So we've looked at those issues about the size, location, and the type of the fibroid. So the question, let's go back what we're talking about. How can one get pregnant with a 4 centimeter uterus fibroid? So we've now looked at the issues around a 4 centimeter fibroid. Now let's talk about the treatment. So in terms of the treatment options, the first thing I will say is that if a woman is thinking about getting pregnant, let me take the share off because I think we're happy. I think we're happy with that. So the first thing I would say, if you're popping in, I'm not very good at checking on my my comments. Okay, so I think I saw a couple of people popping in. Please don't be shy. Say hi. Don't just lurk in the shadows. Come and say hi. So the first thing that we would say, if you're thinking about falling pregnant and you've got fibroids, of course, it's important to establish a regular relationship, a regular follow-up with your gynecologist or with your general practitioner in the first instance, and then your gynecologist. Now, there are different treatment options, as we know, for fibroids. There are medical treatments, hormones, surgical treatments. Generally, if a woman wants to have a child and she has fibroids that we consider may have an effect on her pregnancy or her falling pregnant, we wouldn't recommend medical or hormone treatments because you don't particularly want anything that might affect fertility. So what you want is a situation where a woman is not taking any external hormones, or even though they're able to shrink the fibroids, they may have a side effect that might affect her fertility. So that's generally why hormone treatments will not be recommended. And so by and large, the lady's probably left with surgery or surgery alternatives as an option. And I'm going to explain what I mean by that. The surgery that we're all familiar with in terms of fibroids is the myomectomy, which is where the fibroid is removed. And if you remember some of those images I showed you earlier, and you're having to remove these fibroids to allow the womb space, to allow the baby have the maximal womb space as it's supposed to in order to implant and then to grow. So you need to remove the fibroid for that to happen, and also to remove any possibility that the fibroid can start bleeding. So surgery and myomectomy, that's the most common. And myomectomy can be carried out either by open surgery, in which case the abdominal wall is opened. And of course, again, this depends on the size and location of the fibroid. But that is one of the older methods. The abdominal wall is opened and then the fibroids are removed via the myomectomy surgery. But of course, more recently, there are things like laparoscopy surgery. You have both conventional and robotic surgeries where specific fibroids can be removed without having too many incisions or wide incisions to the lady's body. And so what that means is that you're less likely to have complications, you're less likely to have a long stay in hospital but they will still carry complications. And which method suits which woman is subject to discussion with your gynecologist. It is not a one size fits all. Each of us is different. And I've said at the beginning of this that fibroid symptoms and fibroid types and locations are different from one woman to another. And I don't know if I mentioned this, but of course, it's possible to have more than one fibroid. So all these things will determine which method best suits the woman. So that's myomectomy in terms of removing the fibroid, and the different methods: laparoscopic or open surgery, robotic or conventional laparoscopy. There is also a procedure known as a hysteroscopy, in which a camera is passed through into the womb through the cervix, so that you can actually look and have a look around into the lining of the womb, and while doing so, be able to remove any small sized fibroids that are that you can reach. So this would refer to the submucosal type that I referred to earlier, which are the ones that grow, the types of fibroids that grow from the lining of the womb. So with a hysteroscope, that's that camera that's at the end of this thin tube, it's possible for the specialist to remove the fibroid at the same time that they're looking around within the inner lining of the womb. So that's another method. And again, it depends on the type of fibroid that's present that the woman has. The benefit of this procedure is that it's minimally invasive. Well, it's certainly not as invasive as the laparoscopy or laparotomy, where the fibroid, where a myomectomy is being performed. With the hysteroscopy, the woman can pretty much, once the procedure is over and she's had a few days rest, her cycle continues as usual and she can start trying to conceive. So in terms of time to recovery for the myomectomy compared to the hysteroscopy is less invasive. With the myomectomy, you might find that you're having to wait 3 to 6 months to allow the womb to recover before trying to start to have a baby. So it's really important. And these are considerations that depend not just on what you want, but also the type of fibroid that you have. And the other thing to look at is, the other method to think about is the uterine fibroid embolization. So this is a surgery alternative, doesn't involve surgery. And what happens is special material is injected through one of the vessels in the blood vessels in the body to kill away fibroids. So it goes directly to the blood vessel that supplies blood to the fibroid wherever it's located, and is able to close off that blood supply to the fibroid, and in that way the fibroid eventually shrinks and dies. So that procedure is local, it's direct to the fibroid, and women who've had that procedure can go ahead to have children. There are reports, and we do have women who have gone ahead to have healthy pregnancies afterward. Now, please don't forget that all procedures can have some risks. There could be some complications. There have been some reports about issues to do with the placenta following a uterine fibroid embolization. So again, it's an option. It's important for you to discuss with your specialist to see whether this particular method will suit you. But it is an option for a woman who has a fibroid that may have an effect on her pregnancy. So if you're just joining us, we're looking at this question: how can one get pregnant with a 4-centimeter uterus fibroid? And what we've said is that the main issues that come into this answering this question are looking at the size of the fibroid and its type and location. Those 3 things in particular. Other issues may present, previous treatments, an individual's medical background, and so on, that we're not going into. We're just looking specifically at the fibroid. But these are the issues that will make us look at what options may help best this lady who wants to get pregnant but who has fibroids. And we started by saying that depending on size and location, many women with fibroids do go ahead to have to fall pregnant and to have children. I think we have covered this to a good amount of detail. I think I've covered everything I wanted to say in regards to this topic. So to summarize, I would say it's good to sit down, have a chat with your doctor, whether it's your specialist or whether it's your general practitioner, to look at the options and complications or any risks of these methods. Don't forget that if you've had a myomectomy, for example, there might be a long time to recovery, that is for your womb to recover, so that it can safely carry a pregnancy after the procedure. And that sometimes after myomectomy, even after recovery, there may be a risk of miscarriage or a likelihood that the baby will be delivered by a cesarean section. Not to put anyone off, but just so that we are aware and so we're making informed choice. So I've got somebody saying hi. I'm not sure what your name is. It just says Was. So Was, hello. Thanks for popping in. Let me know if you've got any question. Right, so we've covered that nicely. We're going to go on to the second question. Please don't forget to like and subscribe, like this video. Again, a reminder that we've got lots of fibroid related questions on the, fibroid related topics in the channel. A big playlist about fibroid topics, because I know women worry about this a lot and want to understand the condition, understand what their options are. There are options. We just need to be talking about them and helping women know what is available. So let's head over to number 2. Okay, so this is the second question for this class. I used the implant for 2.5 months. Bleeding lasted for 2 months and I had to remove it. I've been using a low-dose contraceptive pill since May 25th. My bleeding continues. By the way, this question, I think it arrived yesterday or the day before. So May 25th, so what are we looking at? What, 2 weeks plus now? So my heart goes out. It's difficult. Women really have. I shared a post on my community page sometime last week, and I wish I could find it and share it again. But please go and check it out, because it listed all the different things. In fact, where's my phone? It listed all the different things that I've left it somewhere. It listed all the different things that women go through right from the time that we're born, the different health issues that we have to go through from menstruation. I'm just trying to see if I can find it and just go through it. I think it's just worthwhile, talking about it. Women go through such a lot of things, and we should definitely be having these discussions. Let me see if I can find it. Oh, here we go. Things that affect us throughout different stages of our lives: menstruation, birth control, contraception, the S word, pregnancy, childbirth, C-sections, miscarriages, postpartum nursing, parenting, emptiness, hormonal changes, hysterectomies, pelvic floor dysfunction, fibromyalgia. These things need to be mainstream conversation, says Upstate Jen in a Twitter post on the 8th of June 2022. And it's so true. So women do go through quite a few things. So my heart goes out to this lady who used the implant for 2.5 months. And if you're here or you're watching this and you don't know what the implant is, they're talking about let me just see if I think I've got a good picture of this one. So let me share it for you. If you don't know what the contraceptive implant is, it is the what we refer to as the contraceptive implant that contains progesterone that is put underneath your skin, usually the skin of your arm, your upper arm, and you can have this in for years, and it provides contraceptive protection. So it gives you contraception for that period of time while you have the implant in place. And of course, the benefits are you don't have to worry about taking a pill every day or putting a patch on every week, or putting a ring in, or if you've got a regular partner, using condoms, and so it gives you that degree of freedom, if you like. And so it is effective in the sense that it's not relying on the user to do anything in particular. So of course it's more effective. It has a higher effectiveness rate compared to things like condoms or things like the pill. So it's got quite good, it has good statistics, but of course, like pretty much all devices, pretty much all methods, there are some downsides, there are some side effects, and this is one of them: irregular bleeding. So this is and please remember, I say it in my videos where I talk about birth control, and please go and check out my Smart Birth Control playlist. I do talk about a lot of different things around birth control, particularly emergency protection. But it's important that if you experience side effects that are distressing, that you cannot tolerate, you should be speaking to your provider, your healthcare provider, about changing or other measures that you might use to address the problem. Yes, it is true that when you first start a method, you might need to give your body some time to get used to it, to allow hormone levels to sort of settle down, and then things can progress smoothly. And generally, doctors will say to you, look at 6 to 12 weeks of patients with this particular procedure. But that's if it's not causing havoc in your life. So if it's giving you headache and giving you all sorts of horrible problems, please go to your doctor and say, can we change this? Can we remove this? Now, this question, this viewer, and thank you for the question, didn't tell us, what type of bleeding. And again, this is why I don't tend to provide much detail about this kind of comments, or to this kind of comments. Much appreciated, that's true, but it's good to take the discussion away from the comments section, because there isn't that opportunity to gather all the information. And just to remind you that on we also have an email health information and advice service on our website, www.askawayhealth.org. In fact, I will try to share that so that you can see the channel. Just give me 2 seconds so I can pull it up and show you. So if you go to askawayhealth.org, that's our website, and if you go to the top right hand corner, then you will find our email service. I'm going to show this to you if I can briefly, so that just to make sure that it is available for anyone who wants to use that, so we can go through. Yeah, so if you click on the email service here, top right hand corner, so it opens up to our email advice service, okay, which is a free service, but we do take a minimum donation to allow us to make sure that there's enough hands that are able to manage the volume of questions that we get coming in. But you do get a direct response to your inquiry that is detailed to whatever health inquiry that you provide. And you can use this if you want to clarify, get specific information about it. It's very easy to use. Just provide some details and then give us as much information as possible about the problem, so that we can attend to it and attend to you. So that's askawayhealth.org, the email service. Please use that if you want to get more information about a particular health-related question. So back to this. This lady has been having bleeding, lasted for 2 months. So she's given it about 8 weeks, which I think she's given it a reasonable amount of time, and she had to remove it. So yeah, don't be afraid, don't be intimidated or silenced. Insist that this is causing disruption to your life, and you can't tolerate it unless, because it can happen. These methods can be very effective, but for some women, the different types of side effects. Now, she says, so this is the question. I've been using a low-dose contraceptive pill since May 25th. My bleeding continues. So one of the ways that we can use to treat this problem, to manage this problem when somebody starts a new contraceptive method and then they start having abnormal bleeding, it is one of the ways. Of course, it's possible that you just stop it and I'm not having this anymore. But another thing to do is, after stopping it, how do you get the bleeding to settle? What do you do? Of course, again, it's important to get as much information from the lady as possible. Make sure there's nothing else going on that could explain the abnormal bleeding pattern, a sexually transmitted infection or some other condition. I don't want to generalize, but we have to think about other possible causes. And then if it's none of those, we can narrow down and say, right, this is a side effect of this medicine. What can we do in this instance? So the possibilities are to use medicines to control the degree of bleeding. There's some that are related to ibuprofen and aspirin, for example, tranexamic acid, that you may be able to use to control the bleeding and make it lighter. These are non-hormonal, so they don't contain any hormones. That is one option. But the option here that's been used here is the low-dose contraceptive pill. Now, this is most likely a low-dose combined contraceptive pill. So that's the combined pill that's being used to help to calm the bleeding down, which it can do because it will help to regularize the cycle. So what it does, taking the combined pills on a regular basis switches off your body's natural hormones temporarily, because they've sort of taken the implant has sort of they've just gone haywire basically. And it might take some time before they sort of settle down and go into a smooth pattern. So by taking the combined pills, what they'll do is shut off your natural hormones for a time so they can rest. And then any bleeding that you experience subsequently will be the effect of those hormones on your womb lining. So the question she's asking is, how long does she have to bear this because she's still bleeding? Well, again, it varies from one person to the other, but I would expect that this bleeding should calm down as the effect of the low-dose combined pills gets into her system. So she started taking them. It's now 2 weeks. I would expect that by the next time, or within the next 3 to 4 weeks, her bleeding should be settling. She should be getting into a pattern of only a withdrawal bleed when she stops, when she goes for her pill-free period, if she's got a pill-free period. And then when she starts taking the pill again, then she's got bleeding-free days. And so it looks as if she's having a regular cycle. But please remember that, again, it takes some time for the effect of these hormones to build up into your system. Remember that at least taking them for the first 7 days to build up contraceptive protection, and then they begin to shut down any other type of bleeding. Those will probably take a few more days to kick in. So I do think that within the next 1 or 2 more weeks, this bleeding should settle down. And I think that if it isn't, or it's getting heavier, then you should be speaking to your doctor again. And again, this is broad information, literally, we've just got 2 lines of information here. And we can only say in this instance or in that instance. But given that this is being used to treat abnormal bleeding that started as a result of the implant, then it's reasonable to suggest that it's probably the combined pill that she's using. And the effect of the combined pill will be to lighten her bleed and help get a cycle that's regular. And it might take a few weeks for that to happen. And so hopefully, because she's been doing this for a couple of weeks now, so hopefully she should be getting things into a better, she should experience a better pattern, I think, within the next couple of weeks. Otherwise, then she should be having that chat with her doctor. So that's that question. So I hope you guys are doing well. If you're watching this on the replay, I hope you're having a great week so far. Looking forward to the weekend. I am looking forward to the weekend. I am working tonight, so I've got a night shift after some admin work later on after this video, but I've got a night shift and the rest of the weekend. So looking nice, looking forward to that. Hoping for some good weather to be able to get out into the garden. I'm really trying to get my garden organized because I hope that in the next couple of weeks, we should be able to get some videos, if we're lucky, a live stream out in the garden, because of course the weather is getting a bit warmer here in the UK. So I'm looking forward to having a change of scenario. So keep your fingers crossed for my garden. But yes, tell me how you're planning the weekend. Tell me what you're looking forward to doing and all that stuff. So let's go on to the third question. And this is going to be brief. It's a technical one. I love the question. And I'm sort of 2 minds whether to answer it or not. But the fact that people are interested in this issue, I think, is worthwhile. So let's answer it as much as we can. And please don't forget to like and subscribe to the channel, please. Thank you. Don't forget to like the video and subscribe to the channel. Okay, so here's the third question. If my LH continued to surge and I kept getting peak test, does that mean the pill worked? Okay, I'm going to break this down to start with, but I did say this is a bit technical, so I understand if you think, oh, what are we talking about? But just let's stick with it. Will the pill work if you're having an LH surge on BBTs? Okay, so We're talking about the menstrual cycle. LH refers to luteinizing hormone, and peak refers to where the LH peaks, and I'm going to talk a little bit about that. BBT refers to basal body temperature. So basal body temperature is one of those methods that we use to monitor ovulation, because we know that when you start ovulating, or when you're ovulating, your body temperature goes up by about 0.5 degree. So by measuring your body temperature during your cycle, during the days of your cycle, when you get to the point where your temperature has gone up by half a degree, then you're likely ovulating or about to ovulate. That's how that works. So this question is looking at the menstrual cycle and ovulation. Let me pull up, I think it's my last photo or my last image for this stream. Okay, let me pull it up and then I can talk us through, because I always think that's better so that you can. Okay, so this is the menstrual cycle. Or let me take away the question then so that you can see properly. Okay, so this is the menstrual cycle. And I would like you to pay particular attention to LH, which is what the question was referring us to. But let's just quickly talk through what's happening in the menstrual cycle. So the first 4 or 5 days is menstruation, which is when you bleed. And that period of menstruation is within the follicular phase. So your cycle is split in two, the follicular phase and luteal phase. And what splits it into two is ovulation. So we generally say for a woman with a regular cycle that she will ovulate around day 14. Now remember, all these things are estimates. Even with ovulation predictor kits, even with your fertility apps, even with your BBT measurements, even with your cervical mucus and how stringy or not it is, these are still estimates, because presently we can't estimate to the moment, to the second or minute or hour when ovulation happens. That's ovulation being the release of a mature egg from a follicle in the ovary. So we still can't exactly say when it is. And I think that's really important in terms of answering this question, because this is somebody who has an app or is measuring her LH levels, and it's telling her that her LH level has surged, or her LH level is doing this, and she's trying to work out whether, since she's taking the emergency birth control pill, is it still likely to work? So this is the context of this question. Now, your menstrual cycle starts with menstruation and it progresses. So if you follow my cursor, progresses from menstruation towards ovulation. So we're going down towards ovulation. Now keep track of this yellow, because that's the LH. Let's not talk about the other things for now. Let's focus on the LH now, because it's one of the hormones, reproductive hormones. I'm sorry, I should have said. So luteinizing hormone is one of the hormones, and that's responsible for the different outputs, or the different things that happen within a woman's cycle. So as the egg is maturing within the ovary, it gets to the point where it's mature, and the brain sends a signal to the woman's ovary that, okay, this egg is mature and it's time for this egg to be released, because potentially, if intercourse happens, then the egg can be fertilized. So the brain sends that message to the ovary. The ovary picks up that message and then starts to increase this level of this hormone, luteinizing hormone, because it is this hormone that would help to push this egg out of the follicle. That's one of the functions of this hormone, to help ovulation to happen. So at this point is where the surge begins. About 2 days or perhaps a day and a half before ovulation is when this LH surge begins. So let's go back to her question. She said, if my LH continued to surge and I kept getting the peak test, does that mean the pill worked? So what she's saying is she's taking the pill, but then she's taking the pill because she's trying to avoid pregnancy. But then she notices that her LH continues to surge. So this is relevant because the emergency birth control pill works by inhibiting or preventing ovulation. There are different types of the pill. The progesterone containing pill does not work after the LH surge has started. I'll say it again. The progesterone containing pill, so that's example Postinor 2, Plan B, Levonel, Take Action, so on and so forth, does not work after the LH has started to go up. Surge just means the level of the hormone starts to go up. So once the LH surge starts, and you take the progesterone containing pill, then it's less likely to work. Now, this is based on studies. So this is that women have been taken to the laboratory. They've taken blood samples from them in a controlled study situation. They've been given the emergency pill, and then the scientists have looked at what happens to the levels of their hormone after taking the pill. So this information is based on that. So it is possible. Now, she's taken the pill, but her LH continues to surge. Now, that suggests to me that ovulation is still going to happen. So she's not, the pill that she's taken has not affected ovulation, because what the pill is supposed to do, what the emergency birth control pill is supposed to do when you take it, that progesterone is supposed to stop the process of egg release. Supposed to, well, when I say stop, please, what I mean is that it delays it. It's not going to stop it forever. It just that it delays it, and it just stops this function, this whole business of the LH, this message from the brain to the ovary. Okay, start producing LH, start getting ready for an egg. What the pill does is it interferes with that process and delays it for a period of time. So if your ovulation predictor kits, or if your apps are telling you that your LH is still going up, if it's still surging, then the pill hasn't worked. But can I just say that I also, and if you look at my smart birth control video playlist, I do say that there's no point looking at all these things to check whether or not the pill has worked. So you've taken the pill and then you're looking to see, has it worked because you're bleeding, or because your app is saying this, or because your predictor kit is saying that. There's really, that's not really going to tell you. I know that we're looking for the reassurance that, okay, fine, you're going to be okay. I know, but relying on any of these measures, it doesn't really tell you one way or the other. At the end of the day, you're going to have to wait until either your next period appears, as it should do, because then that tells you that the pill has worked, or if it's delayed and you do a pregnancy test, that tells you whether or not you're pregnant. Those are the conclusive ways to determine if the pill worked. But please check out my video where I look at that subject specifically. In any case, back to this drawing, and I'm just going to round up very quickly by saying, the important thing when you're taking the emergency birth control pill, there are two timings that are important. The two timings that are important are the time that you had intercourse, or that you and your partner did it. And the second timing that is important is the timing of your cycle. With the time of when you guys did it, you have 72 hours from that time. That is with the progesterone pills. You've got 72 hours. I'll take off this image now. Stop sharing. Yeah. You have 72 hours to take emergency the contraceptive pill. Or if you're going to use Ella, because with Ella you have 120 hours, up to 5 days from unprotected intercourse. With the coil, which is the most effective, the copper coil that's inserted into the womb, you can take that within 5 days of intercourse. It's the most effective, even if you have ovulated. But we're talking about the pill because, of course, this question refers to the pill. So the most important thing is, with the timing of intercourse, take the pill as soon as possible. Yes, the issue of ovulation, whether or not you've ovulated, is important. And yes, it is true that the pills work by delaying ovulation. So you might say, well, what's the point of taking it later on in the cycle? I've already ovulated. Well, the thing I would say to you is, we're still predicting and estimating the times of ovulation. So please take, if you need to, the key thing is to take it as soon as possible after unprotected intercourse, at any time in your cycle. And don't play the game of using your app or using your whatever tool you're using to say, well, I was definitely ovulating then, so I'm not going to bother with the pill. No, because that's a risk that you're taking. In some women who have regular cycles, they might ovulate on the 14th of the month this time, and then next month they ovulate on the 16th of the month or on the 17th, because life happens, because maybe they're a bit stressed the following month, or they're ill, or they're whatever, different things might affect, or they're not even, you don't even have to bring stress or illness into it. The pattern, the way that our bodies, the fluctuations of our hormones might mean ovulation happens on this particular day of the month, but not on that same day or exactly 28 days of within the next month. So there might be some of these changes, and it means that we're still estimating ovulation, regardless of what our ovulation predictors or apps and things are telling us. And that's why while timing of ovulation is important, but timing of intercourse is what you use to determine when you're taking the pill, as soon as possible after intercourse. Yes, it is true that if you have taken it, I've also done a video on the reasons why the pill failed. If you've taken it after ovulation, then of course, if it's the pills, then they're less likely to work. Some studies suggest that they may be able to prevent implantation and so on. There's schools of thought there, but the primary way that they work is by preventing ovulation. So to make sure that we've covered this question. So she says she keeps getting peak tests. That means she's getting her app or whatever she's using is telling her that she's got the LH levels are surging and she's getting peaks. Well, that's telling her that she's about to ovulate. And if she's asking whether or not the pill has worked, it's suggesting that she could still potentially get pregnant despite taking the pill, because perhaps she's taking it at a time when the pill could no longer affect the LH surge. And she says, will the pill work if you're having an LH surge on basal? I presume this is what she means, on basal body temperature. Will the pill work? So if the LH surge has already happened and your basal body temperature is up, if it's the progesterone pill, it's unlikely to work. Unlikely, because it can only work before the LH surge has happened. With Ella can still work up to the point where LH peak, where it's at the highest and where the egg is released. So Ella can still work up to that point. So again, these are technical details, and I would still say to women, instead of you're busy worrying about, well, is it going to work or is it not going to work? If you're particularly concerned, you're not sure about ovulation, you're not sure, make sure you're taking the pill, if it's the pill that you have, as soon as possible, because that gives you the highest chance that it is the most effective. Even better, if you can get the copper coil fitted, then that should be the option. So I think that covers this question. And thank you to my viewer who provided that question. It's technical, but I thought it was really interesting because obviously she's using her ovulation predictor kits or her apps and just wanting to understand how her body works, which is really great. We should do that. So guys, I hope this has been useful. I'm going to sign off the stream now. Please don't forget that if you've got any questions, I'm happy to go through them. I answer them in the comments. I also answer them on a video like this. I think you get the best value by sending a question into the health service, the email service, and I've shown you how to get through to that. It's via our website, askawayhealth.org. Click on email service on the top right-hand corner, and you'll get a direct, detailed response from me or any of my colleagues. But please don't forget to check our other playlist videos for fibroids. Check our other playlists for smart birth control, because there's so much information out there. But send in your questions, different topics that you want us to look into around women's health, family health, and of course sexual health, so that we can get into things and help us live better. Thank you so much for listening. I am going to have I'm going to go and sit out in the garden, just catch up on some admin work, and then later on get some rest, because I'm pretty sure we probably got a busy night ahead of us at work. But I hope you stay well, and let me know in the comments what you thought about the video. Let me know what your plans are for the weekend, and until the next time I see you, stay well.